So this is the most important topic in hypertension course, which tells us about the management of hypertension. So this is we have prepared this topic with the evidence and as well as our practical based approach to the management of hypertension. So what is very important to understand today is that hypertension cardiovascular mortality doubles for every 20/10 millimeters of increase in systolic and diastolic pressure. For example, although you think 140/90 is normal blood pressure, reducing it to 120 millimeters of mercury reduces the cardiovascular mortality by twice. So even reduction of blood pressure in the normal range yields you benefit. So any pressure above 120/80 or 115/75, 20 millimeter systolic and 10 millimeter diastolic pressure increases doubles the cardiovascular mortality. That's why the newer guidelines are becoming, the target of blood pressure is becoming low and low, because the lower the blood pressure, better is the prognosis. So this is the most important idea before we go into management of hypertension. So there is a lot of non-pharmacological management in hypertension before we go in for pharmacotherapy based management of hypertension. So when you have healthy lifestyle changes, they can prevent hypertension, they can delay the onset of hypertension, and they can reduce cardiovascular things. So three things are possible with lifestyle modification: prevention, delaying, and reduce the risk of cardiovascular risk. So eating a diet which is rich in whole grains, fruits, vegetables, polyunsaturated fats, dairy products, reducing food high in sugar, especially that is carbohydrate and saturated fat and trans fats. So this is what described in dietary advice to stop hypertension diet. So intake of vegetables high in nitrates are known to reduce blood pressure, such as leafy vegetables as well as beetroot. These are high in nitrates. Other beneficial foods and nutrients are include avocados, nuts, seeds and legumes and tofu, which are rich in magnesium, calcium and potassium. So the energies, this mineral source from the natural source, the